Mom, are you ready yet? Let me find my other shoe, then we're gonna go. Finally found it. Good. We're late. I love you, but you always make us late.
I'm ready.
Come on. Come on.
Hi there.
Hello.
Hi, I'm Jenny. I'm the nurse that's been taking care of Sam today. Who are you to the patient?
I'm her daughter, Brittany.
Oh, great. It's great to see family here. I'd like to go over a couple questions and other things that I have found with Sam. Is that okay with you?
Oh, that sounds good.
Great. Well, first off, I got Sam's story of how the fracture happened, and I would just like your side of the story. What happened?
We were late, and Mom always takes forever to do everything. And I was rushing her, and she fell. Feel bad.
Okay. Well,
So will this get better? I mean, it's really wreaking havoc on our life. We can't do anything. We're always late for everything. She can't take care of herself.
Well, unfortunately, this disease will progressively get worse as time passes. But I promise that I will do everything I can to help her function as independently for as long as possible. Well, and along with many other caregivers. And we want to help with the tremors as well, which will hopefully help her to eat more efficiently, which will overall help her condition. We also have done screening for depression and dementia. Depression and dementia is not a normal part of aging, and from my understanding, there has been a lack of sharpness compared to Sam's condition.
Yeah,
before.
she's not the same as she used to be.
You know, I am right here. You can
I'm sorry,
talk to me
Sam.
too.
Sorry, Mom.
And are you feeling a little less sharp, or are you feeling right on point still?
I don't know, just this medication's just not right.
Mom, you complain so much. The medication's making you better.
I don't know about that.
Well, actually, we are going to go ahead and do some changes with your medications. You have recently been on Parladel, and this is a drug of choice in younger patients. However, this disease has progressed in you through the years, and this medication is no longer appropriate for your condition. So what's going to happen next is that we're going to get you started on carbidopa-levodopa.
What's that?
It's also called Cinemet, and it's the drug of choice that for patients who have got functional impairments. I'm sorry, Sam. Which would be your falls, and your eating. So.
What's wrong with my eating?
Mom, you take forever to eat. Sometimes she doesn't even finish her meals at all.
And we want you to be able to eat your meals. And that will help with your nutrition status too. You'll feel better if you have got the proper nutrients in your body. So carbidopa-levodopa is a drug, dopamine replacement drug. And
Oh, okay, what does that mean? Explain that to me like I'm a 5-year-old, but I'm not a 5-year-old.
Okay. What that means is there's two chemicals that work in your brain. There's dopamine and acetylcholine, and they work together to move your muscles. And if the body is not making dopamine, which is used for muscle control, helps muscles relax, that's when the tremors start. So this medication helps the body make dopamine, so which should help with the tremors.
Was it a cure then? Will it cure it?
No, unfortunately, there is no known cure for Parkinson's at this time, but it will treat the symptoms such as the tremors, muscle stiffness, and spasms, and your poor muscle control.
I hope so. She looks really uncomfortable right now.
Yes, yeah. And I reviewed your medical history and medications, and I see that there's no reason for you not to take this medication. However, it is important to avoid a diet that's high in protein and iron because it makes it hard for your body to absorb this Cinemet and be useful for your body with the extra protein and iron.
Looks like we'll have to make a couple adjustments, I guess. But it'll be okay.
Do you have
Maybe.
any questions?
Not really. Doesn't look like Mom does either.
Well, I'm just going to go over a couple side effects really with you real quick if that's okay. I know it's a lot of information.
Okay.
Okay, thank you. Hi Sam, where'd your daughter head off to?
She had to go pick up my grandchild.
Oh, she did. Well, I wanted to cover a couple side effects with you for this new medication that you're going to start.
Great, because this is just too much. I don't understand everything.
Okay, well, I want you to know that I'm here for any questions. Do you have any questions right now?
I just want to know about these side effects.
Okay. Well, some side effects are heart palpitations, which means your heart just kind of feels like it's fluttering in your chest. Hypotension, which is low blood pressure. Urinary retention, which means that you may not go pee quite as easily or often as you did. Depression and muscle cramps. But please, please let me, your doctor, your daughter know if you are experiencing any of these side effects. Because Sam, they might be confused with new or unnoticed symptoms of the Parkinson's disease. And then at that point, we will need to reevaluate. The medication dose that we're going to start you on is actually the lowest dose. It's 10 carbidopa, 100 levodopa, 3 times a day. But it's just going to be one pill. That's going to be the dose in one pill 3 times a day.
Great,
Okay.
because I take too many medicines already.
Yeah. Well, hopefully we can keep it down for you. So, do you have any questions right now?
Are you going to tell my daughter this when she comes back?
Of course, I'll pass the information on to your
Okay,
daughter and make
great,
sure she
thank you.
You're welcome. So, is there anything else I can answer for you?
I don't think so. I think you got it all, dear.
Okay.
So this will be a cup to help with some of the spills. Because of the shaking, we have a lid here. I'm sure you've seen these before.
Actually, I haven't. That's
Something
pretty
similar?
cool. Are those
Mhm.
expensive?
Your insurance is going to cover these today. These are going to go home with you. So hopefully these will help make the meals go by a little bit smoother. These are weighted silverware. Do you want to feel that?
Yeah, it's pretty heavy.
That should help control some of the tremors in the hand. Give her a little bit more stimulus
Can she hold one?
to hold them. Yes?
I would like to try that.
Okay. And then we got your plate here with the rim. And that'll allow you to keep your food on your spoon a little bit easier and not less on your lap.
I think that's going to work.
Satisfaction guaranteed.
All right. Thank you. We're also going to take you down before you go, probably in an hour or so. We'll go down to the physical therapy department, and then we're going to go over use of the walker and how Brittany can help you keep that under you.
That sounds good to me.
I think that'll be nice.
Good. If you have any more questions, I'll meet with you again tomorrow before you go home and answer any questions that you have.
Is that okay, Mom?
I'm good.
All right, sounds
Thank
good to
you.
me. Thank you.
So I guess you're just stuck with me, and I am your mother, and what I say goes.
Amy, how do you think that Sam's been doing since you've been able to spend some time with her?
You know, I've watched Sam come a long way. And as we know, Parkinson's is not going to get any better. And it's at stage 3. I do have some concerns, some major turning point for the family and for the deceased.
Okay.
I think we're really gonna have to focus on trying to figure out what Brittany and Sam have planned for care outside of the home.
Okay.
It's gonna take a thorough evaluation of the home and to see what resources they have available to them at home before we can consider releasing her to go home.
Brittany, we called this meeting here today to discuss whether or not your mom's going to be able to come home with you. So I do have a few questions to ask you. One thing we have to consider is, where are you living?
Well, we live about 10 miles out of town, in the country, pretty far away from civilization, I guess.
Okay. Do you have adequate transportation to get your mom to and from appointments and pick up prescriptions?
Yeah, but to get into town several times a week is going to get pretty expensive. I'm not sure if I can do that.
Okay, well, what we can do is we can set up physical therapy and occupational therapy to come out to your home, if that's okay with you.
That sounds good.
And the other benefits of this is that they'll be able to look at your house and see what modifications can be made to help your mother move around safely. Can you describe to me a meal, like an average meal in your home?
Well, we eat a lot of venison. My nephew's a hunter, so he pretty much brings us everything he kills.
Great.
Sits on our doorstep.
Well, that's wonderful. Another thing we have to think about is incorporating nutrition, such as vegetables and fresh fruits. Do you have access to any of this?
Oh, yeah. We have a neighbor who has a really big garden. He's always offering us stuff.
Oh, that's good. One other question. Brittany, it's important for you to know that as this disease progresses, there will be a lot of changes with your mother. Eventually, she may need total care. And what that means is that you may need to bathe her. You're going to have to help her with her meals, get her dressed, and you may need to set up like a toileting schedule, which means you're taking her to and from the bathroom at set intervals, and a walker. So the question to ask is, at this time, with support services available to you, would you be comfortable with your mom coming home?
Yeah, I think so. I'm actually pretty excited about it. Definitely a lot more so than at first. I was worried about her losing her independence. I was worried for us financially, but it really seems like she's come a long way. It's going to be hard, but I think good times are ahead.
I would agree. And as for you, Brittany, don't be afraid to ask for help if you need it. There are a lot of changes that you have to accept, but it's important for you to make time for yourself and to limit stress. Your mom will benefit the most. Have you or your mother looked into Parkinson's support groups?
I actually have not.
Okay. Well, I would encourage you to look into your local hospitals and find out any area that may be offering that, and I can help you with those resources on my end. And thank you again. I think this will really help your mom in her recovery.
I think so too. That sounds really good. It'll be nice to have some support because it gets really stressful at times. I get really frustrated and mad at her.
I imagine you do. Well, good luck, and please don't hesitate to ask for anything.
Okay, thank you very much. I appreciate it.